a short phrase. It should be a word അല്ലെങ്കിൽ ഒരു short phrase ആയിരിക്കും. So what is a short phrase? എപ്പോഴും you guys will forget about it because when I check papers I can see a lot of careless mistakes in the paper regarding short answer as well as in fill in the blanks. And the reason is that you guys are not remembering, or you guys are not alert about this word or short phrase kind of answers. അല്ലേ, അവിടെ ക്ലിയർ ആയിട്ട് പറയുന്നുണ്ട് യു ക്യാൻ ആൻസർ ഇൻ എ വേർഡ് ഓർ എ ഷോർട്ട് ഫ്രേസ്. അത് തന്നെ ഫോളോ ചെയ്യണം, അതർവൈസ് ഐ വിൽ ജസ്റ്റ് റൈറ്റ് ഇറ്റ് ഓഫ്. ഓക്കെ, യെസ്. സോ ദാറ്റ്സ് ഓൾ അബൌട്ട് ഷോർട്ട് ആൻസർ ആസ് വെൽ as fill in the blank. Same instruction is mentioned. See, word or a short phrase, you can answer in a word or a short phrase. Clear? Hi Shibi, good evening. Yes, Josna, good evening. Kavita, Nimi, Sunida, happy to see you guys here. Anyway, coming back to part A. And when you do these text A, B, C and D, we need a technique here, or we need a method, a strategy here, which can be called skimming and scanning method. അതിനെ നമ്മൾ സിംപ്ലി പറയുന്നതാണ്, that's called skimming and scanning. So what is skimming and scanning? Suppose somebody is asking, okay ma'am, what is skimming? I can say fast reading. Okay, suppose I'm giving a paragraph in front of you. It's not very easy for you to read within seconds. Okay, because it is the first time you guys are seeing that particular paragraph. So it's not very easy for you to read in seconds. Maybe you will take, for the first time, maybe you will take 5 minutes, maybe. But I'm showing the same paragraph again, you can take maybe 3 minutes. What about the, whenever I'm repeating the same thing, it can reduce. What can reduce? The time can reduce. Clear? So that is called a reading habit or reading practice. When you practice reading every day, it will be easy for you to practice fast reading as well as you can read things very fastly. പെട്ടെന്ന് നമ്മൾ വായിക്കാൻ പഠിക്കും. ക്ലിയർ? ഓൾ റൈറ്റ്. പ്ലസ് വാട്ട് ഇസ് സ്കാനിങ്, വിച്ച് മീൻസ് സ്കാൻ ചെയ്യാന്ന് പറഞ്ഞാൽ എന്താണ്? വി ആർ ജസ്റ്റ് ഐഡൻറ്റിഫൈങ് സംതിങ്, റൈറ്റ്? സോ ഇൻ റീഡിങ്, സ്കാനിങ് വിച്ച് മീൻസ് വി ആർ ഫൈൻഡിങ് സർട്ടൻ ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ് ഫ്രം ദ ടെക്സ്റ്റ്. Plus you should underline that particular words, because if you're not underlining, you guys will just forgot it. Okay, ningal adu marakkum. So please do underline the important words. Okay, yes. So what is this topic is all about? JIA. So what is JIA? So JIA, which means so JIA, which means juvenile idiopathic arthritis. And here in this particular text, in text A, already I think you guys have done this material, right? നിങ്ങൾ ചെയ്തിട്ടുണ്ടെന്ന് ഞാൻ വിചാരിക്കുന്നു. Yes, Rebecca, to find important words, that is called scanning. Very good, dear. Yeah, excellent. Hi Grishma, good evening. Yes, John C, good evening. Hi ma'am, I've cleared OET Reading 360. I got, ma'am, thank you very much. Congratulations, dear. Okay, I'm so happy to see your score here. Anyway, you are an inspiration to every student, so every other student. Okay, yes, കാണുന്നുണ്ടല്ലോ എല്ലാവരും, കണ്ടോ? സോ ദുർഗനെ പോലെ you guys have to say in the comment box, okay ma'am, we cleared it. ഞങ്ങൾ ഈ എക്സാം ക്ലിയർ ചെയ്തു, we got this much marks, 360, 370, 80, 400 above. Okay, yes, I'm just hoping for a positive result. Yes, yeah. So coming back to text A, what is in text A? Give me an overall idea. Just comment it here. എന്താണ് ടെക്സ്റ്റ് എയിൽ പറയുന്നതെന്നൊന്ന് കമൻറ്റ് ചെയ്യാമോ? വാട്ട് ഇസ് ദ ഓവറോൾ ഐഡിയ, ഓർ ഇൻ എ നട്ട്ഷെൽ വാട്ട് യു ക്യാൻ സേ വാട്ട് ഇസ് മെൻഷൻഡ് ഇൻ ടെക്സ്റ്റ് എ? എന്താണ് ടെക്സ്റ്റ് എയിൽ പറഞ്ഞിരിക്കുന്നത്? any important things in text A you can see? Can you see any important things, or this is the gist about text A? അങ്ങനെ എന്തെങ്കിലും പറയാൻ പറ്റുന്നുണ്ടോ? ഒന്ന് നോക്കിയിട്ട് പറയാമോ? വാട്ട് ഇസ് ഇൻ ടെക്സ്റ്റ് എ? യെസ് ബ്യൂല. യാ, സോ വാട്ട് ഇസ് ഇൻ ടെക്സ്റ്റ് എ? ഹായ് സാൻസി, ഗുഡ് ഈവനിങ്. എന്താ ടെക്സ്റ്റ് എയിൽ പറയുന്നത്? വാട്ട് ഈസ് ദ ഓവറോൾ ഐഡിയ ഇൻ ടെക്സ്റ്റ് എ? juvenile idiopathic arthritis, or JIA. I think there is another word for this particular disease condition. It is juvenile rheumatoid arthritis, that is JRA, but officially it's that particular term. I mean, JRA is used by not very recently they are using it. Yeah, it's a little bit old. Anyway, yeah, so no comments. Introduction and signs and symptoms. Very good, dear. Yes, Nancy. So introduction, in the sense we can say, okay, what is this disease condition? Endana JIA. Okay, and what are the important signs and symptoms mentioned here? So that's all about the summary of the text A. Very good. And what is in text? Yeah. So what is in text B? Yes. So what is in text B? The key characteristics of JIA subtypes: frequency, age of onset, and gender distribution. So this is a table. And you can expect in one of the text will be a pictorial of something, as you guys already know. And the pictorial maybe or a table, maybe they will give you a table or a flow chart or a diagram, or a graph. So whatever, yeah, maybe you can expect a table or a diagram or a graph. Okay, so definitely one of the text will be a pictorial of something. And here it is all about what are the characteristics of this subtypes of this condition. Idinte characteristics എന്തൊക്കെയാണ്? Yes, Shijana, Nizam, it's introduction, very good dear. Yes, Anju, symptoms and introduction mentioned. Yes, Nami, symptoms and causes, very good. Okay, and what about in text C? Text C എന്താണെന്ന് പറയാമോ? And one more thing I just want to remind you, whatever mentioned in this table, okay, as you can see here, this is a table. This is a table ആണ്. And in this line, I mean in the under the table there is a particular not mentioned with a star mark or something. It's also important. It's important ഒന്നുമല്ല, വായിക്കേണ്ട കാര്യമില്ല. No, it's important. Maybe they will ask you questions. അത് ഉറപ്പില്ല, ചോദിക്കും എന്നല്ല ഞാൻ പറയുന്നത്. Maybe they can ask you questions. Whatever trick they can use, they will use it. അവർ എന്തൊക്കെ ട്രിക്ക് യൂസ് ചെയ്യാൻ പറ്റുമോ അതെല്ലാം അവർ യൂസ് ചെയ്യും. So we have to read each and every line very clearly. നമ്മൾ നമ്മുടെ പാർട്ട് കംപ്ലീറ്റ് ആയിട്ട് ചെയ്യുക. Clear? Yeah, so what is in text C? Very good, Nimi. It's all about the diagnosis, how to identify JIA through different tests. ഓരോ ടെസ്റ്റ് വഴി ഇത് എങ്ങനെ കണ്ടുപിടിക്കാം? How will you identify JIA with the help of different tests mentioned here? Yes. And what about text D? And text D is all about, again, a flow chart as mentioned. ഒരു pictorial ആണ്. Yes, it is a pictorial mention and this is a flow chart. അല്ലേ? Yes. And hope you have underlined some keywords from text A, B, C and D. Let me check your answers. So I'm starting with the first question. Okay, ആദ്യത്തെ question ഞാൻ start ചെയ്യുവാണ്. What are the usual signs of juvenile idiopathic arthritis? Clear? Yes, Arya, it's all about the diagnosis. Very good, dear. And text D, it's all about text D, a pictorial of the patient with polyarthritis, right? Yes. Then, yeah. Yes, Anju. Hi, Ashwati. Good evening. Yeah, intervention is mentioned there. Very good. Yes, in text D, it's all about the intervention. Yeah. So, first question. What are the usual signs of juvenile idiopathic arthritis? Let me know in the comment box what is your answer. And let me tell you my keywords from the question, which are usual signs arthritis. Okay, so likewise you guys can underline. See, this is not important. You have to underline more than 3 keywords or 3 keywords. The important instruction which I just give to my students, which is you can underline words but not more than 3. Okay, but the students underline ചെയ്യും, ചില students more than 3 keywords underline ചെയ്യും, and whatever I do is I'll just call them. ഞാൻ ഒരു വഴക്ക് പറയും. Simply I'll just call them. And maybe they are asking, okay, thinking, okay, why ma'am is calling us, but now they know. അവർക്ക് ഇപ്പോൾ അറിയാൻ പറ്റും, അല്ലേ? Why we are underlining 3 words? Because otherwise it will be confusing for us. Clear? So we can do one thing. Please do underline keywords, which is 3 keywords you can underline or less than 3. Don't underline more than 3 keywords. Clear? Yes. So my keywords, usual, signs, arthritis. Okay, so let me know in the comment box your answers, guys. A lot of answers, yes. Yeah. So it is from text A, right? Yes. So usual signs of juvenile idiopathic arthritis, and which is mentioned here in text A. So yes, it is mentioned in text A. Okay, so what are your keywords from the question? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? ഇപ്പോൾ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ നിങ്ങൾ ആണെന്നുണ്ടെങ്കിൽ നിങ്ങൾ എന്തൊക്കെ കീവേഡ്സ് അണ്ടർലൈൻ ചെയ്യും? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ? വാട്ട് ആർ യുവർ കീവേഡ്സ് ഫ്രം ടെക്സ്റ്റ് എ? സോ വാട്ട് ആർ യുവർ കീവേഡ്സ് ഫ്രം ടെക്സ്റ്റ് എ? നിങ്ങളാണെങ്കിൽ എന്ത് കീവേഡ്സ് കമൻറ്റ് ചെയ്യും? ഏതൊക്കെയാണ് നിങ്ങളുടെ കീവേഡ്സ് ഫ്രം ടെക്സ്റ്റ് എ? വാട്ട് ആർ യുവർ കീവേഡ്സ് ഫ്രം text A? Yes. ഒന്ന് പറയാമോ? Okay. Yes. So, unusual, signs, juvenile. Or you can underline. Yes. Okay, Anju. Okay, yeah. So yes, What are the usual signs of juvenile idiopathic arthritis? And simply I can say answer is mentioned in text A, right? Yeah, which is mentioned in text A. So yes, answer is mentioned in A. So that is A. Yes. And what about the second question? Yeah, a lot of correct answers. Yes, Swati. Yes, Anu. Yes, Johnsy. Yes, Grishma, Anju, Shijana. Uh, so yeah. So these are the keywords. Okay. Usual signs and so yes, once again, so sorry for the glitches. Yes. So coming back. So answer is from text A and very direct answer because you don't even have to read it. You guys know that, right? The all most common signs and symptoms of juvenile idiopathic arthritis are these are the signs and symptoms mentioned. So very direct answer, which is from text A. Yes. So coming to the second question, imaging modalities employed to discern joint damages resulting from JIA. So here, there are some words which you are not familiar with, but I think majority of my students maybe have an idea regarding what is modality and discern, right? Because if you guys are attending this live session every day, definitely you know what are these words and what is the meaning of this word, right? Imaging modality is some methods, procedures for the identification, that is discern, which means diagnose, identify. അപ്പോൾ ഐഡൻറ്റിഫൈ ചെയ്യാൻ യൂസ് ചെയ്യുന്ന ടെക്നിക്സ് എവിടെ മെൻഷൻ ചെയ്തേക്കുന്നത്? വെർ ഇസ് ഇറ്റ് മെൻഷൻഡ്? Very directly, which is mentioned in text C. Very good, Anju. Yes, Swati, Beulah, Anu, Anju, Nimmi, John C. Hi, John C. Yes, text C. Yes, Santa, it is mentioned in text C. Third one, what constitutes the treatment approach for polyarthritis? So my keywords constitutes and approach polyarthritis. So where is polyarthritis mentioned? And this word polyarthritis, it's only mentioned in one text, right? ഏതോ ഒരു ടെക്സ്റ്റിൽ മാത്രമാണ് ഇത് മെൻഷൻ ചെയ്തിട്ടുള്ളൂ. Which text? Yeah, let me know in the comment box. Where is polyarthritis mentioned? See, patient with polyarthritis, JIA. First of all, they can do what? Rheumatoid factor, if it is positive, then they can treat as adult rheumatoid arthritis. If it is negative, then this is the next treatment option. So the initiative, or I can say the management, is mentioned here in text D regarding polyarthritis. Not polio, polyarthritis. So answer is D. Clear? Yes. Yeah, it is text D. Very good, very good. Yes, Swati, Anju. Yeah, it is in text D. Fourth one, presence of anti-nuclear antibody in body even while JIA is not present. So whenever you see a word which is negative, you should underline it. Even if it is in text A, even if, sorry, part A, part B or part C, whenever you found or whenever you find a negative word, you should underline that. If it is not present, analyze. So where is not present mentioned? JIA is not present. Which text? Fourth one. Yes, Beulah, very good. Your answer is correct here. Answer is mentioned in text C. Yes, yes, very good, Sansi. Answer is mentioned in text C. Yes, Jonesy. Third one is D. Very good here. Fifth one, comprehensive medical interventions recommended for serious flare-ups of JIA. So comprehensive interventions as well as JIA, the condition. Okay, so comprehensive, which means including a lot of factors, broad. Intervention, which means what? Treatment options. So comprehensive medical interventions mentioned. Which text? Yeah, very direct answer. Very simple, right? Mentioned in text D. Okay. So my intention is that you guys have to study a lot of synonyms through these texts. I mean, from this particular questions. ഇതിന് നിങ്ങൾക്ക് എന്ത് പഠിക്കാം? A lot of unfamiliar words you can study. So please do mark those unfamiliar words and find out the meaning, study it. Clear? So when you do the next material, it will help you to find out the answers very quickly. അപ്പോൾ നിങ്ങൾക്ക് ഈ മീനിങ്സ് ഒക്കെ അറിയാവുന്നത് എന്തുകൊണ്ടാണ്? Because you guys are attending the live session every day, right? Yeah. Yes, Anu, third one is D. Yeah, yes, Shijana, third one is D. Yes, yes. So now, sixth question. What fraction is specifically allocated to enthesitis-related arthritis? So, fraction, enthesitis, and arthritis. So, where is the fraction mentioned? Some, proportion mentioned or a ratio mentioned. Where is it mentioned? Fraction. Where is the fraction mentioned? Yes. It is from text B. As you can see here, enthesitis related arthritis and 3 to 1, see, percent of all cases. So percentage, which means a fraction. Okay, or you can connect with the proportion. So answer is mentioned, very direct answer from text B. Clear? So answer is mentioned in text B. That is the correct answer. Seventh one, which gender exhibits a higher vulnerability towards psoriatic arthritis? So my keywords, gender, vulnerability, and psoriatic. Gender, as you know, exhibits, which means they will show a vulnerability. What is vulnerability? That means susceptibility or weakness towards this psoriatic arthritis. And where is psoriatic arthritis mentioned? And I've seen that word only in text B, I guess. So, yeah. So there is a word psoriatic arthritis here in text B. So the vulnerability, it can affect 2 to 11% of people. So answer is mentioned in text B. Clear? See? So that is the correct answer. So A, C, D, Z, D, double B. Yes. How many correct answers? Yes, Sansi, Anju, Swati, Shijana, Santa, yeah, Kavita, Anu. Yeah, very good, very good, very good. Correct answer. And I'm just jumping to 8 to 14 set of questions. Yes, short answer questions. First one. What do elevated levels of rheumatoid factor in a blood test suggest as the disease condition? So, already I've underlined my keywords here, elevated and rheumatoid factor, blood test. So, these are my keywords from the question and I'll give you the answer. Answer is, my answer is polyarthritis, and which is mentioned in text B. Already we know, sorry, it's not in text B. Yeah, text C. Okay, so as you can see here in text C, yes, where is it mentioned text C? A lot of correct answers. Yes, Anju, Helen, Shijana, Kavita, Anju, very good, 7 out of 7. So what about 8th question, guys? Let me know in the comment box what is your answer for 8th question. Very good, yes, polyarthritis. Very good, Nimi. And answer is mentioned in text C. Alle, 4th point ano? Yes. So, rheumatoid factor, one of the keyword from the question, may show up in children with polyarthritis. A very direct answer. Answer is polyarthritis. 9th one. So, what about 9th one? In JIA, well, might initial swelling be evident in one of the largest joints? So, where is it evident? Where? See, question evident. They need the exact place there. And my answer is knee. Ano, what is your answer? Is it knee? Let me know in the comment box whether it is right or not, okay? Yes, yes, Santa, yes, Anju, it is polyarthritis. And what about 9th one? It's knee. And where is knee mentioned? It is mentioned in text A. I've seen that word in text A. And a lot of symptoms mentioned. So, swelling. So, swelling is one of the keywords. Remember, joint swelling is a common but often first noticed, see, initially. In larger joints, another keyword. And it is in knee, the knee. So, either you can write there the knee, or you can write knee. So, I will suggest you to write the knee. The knee nolladana, it's more proper. Okay, because article is very important in reading. So, you can write there. 10th one. At what age does psoriatic arthritis typically reach its zenith? Zenith, which means peak, highest. Okay, അതിൻ്റെ പീക്കിൽ എത്തുന്നത് എപ്പോഴാണ്? ഹയസ്റ്റ് നിൽക്കുന്ന എപ്പോഴാണ്? സോ എപ്പോഴാണ്? At what age? ഏത് ഏജിലാണെന്നാണ് question. So my answer is 9 to 11 years. Don't write years. Years not mentioned there. That abbreviation is mentioned as Y. 9 to 11 Y എന്നാണ് കൊടുത്തേക്കുന്നത്. Doesn't mention about years. So yeah. So biphasic distribution, early peak 2 to 4 years, latter peak at 9 to 11 years. Kandalla. So answer is 9 to 11 Y. Clear? Yes. Year mentioned alla to kavita. Just sorry. So adi it's just Y. 9 to 11 Y nedam paadallu kato. Yeah, 11th one. When do children typically experience difficulties like pain and stiffness associated with JIA aside from after siesta? What is siesta which means? Siesta which means afternoon sleep. Okay, ഉച്ചയുറക്കം എന്നൊക്കെ പറയില്ലേ, that's called siesta. A very short sleep. ഒരു നാപ്പ് എടുക്കുന്നതൊക്കെയാണ്, that's called siesta. So after siesta, where is it mentioned? When do children? എപ്പോഴാ? When do children? And I think answer is mentioned in text A because a lot of timings mentioned in text A. And related to that, it's mentioned like pain, because that is my first keyword. While your child might not complain of joint pain, you may notice that he or her she limps, especially the first thing in the morning, and after a nap ആണ് in the siesta. And another is stiffness, right? So stiffness in them എപ്പോഴാണ് കൊടുത്തേക്കുന്നത്? Particularly in the morning after nap. That means siesta. So answer is morning. Okay. But question is asking when. എപ്പോഴാണ്? So you can write not morning, in the morning. അങ്ങനെയല്ലേ പറഞ്ഞിരിക്കുന്നത് അവിടെ? I think so. In the morning. Yes. So answer is in the morning. That in indicates when. Timing കാണിക്കുന്ന in ആണ്. So answer is in the morning. So that is the correct answer. Then 12th one. For patients diagnosed with systemic onset of JIA, what is recommended a course of treatment? ഏത് കോഴ്സ് ഓഫ് ട്രീറ്റ്മെൻ്റ് ആണ് ഇവിടെ റെക്കമെൻഡ് ചെയ്യുന്നത്? ആൻഡ് ദിസ് ആൻസർ ഇസ് ക്വൈറ്റ് ലെങ്തി, ബട്ട് യു ഡോണ്ട് ഹാവ് ടു കൺസിഡർ ദാറ്റ് നമ്പർ ഹിയർ ആസ് എ വേർഡ്. ഇവിടെ നമ്മൾ ഒരിക്കലും നമ്പേഴ്സ് വേർഡ്സ് ആയിട്ട് കൺസിഡർ ചെയ്യുന്നില്ല. ഓക്കെ, സോ യു ക്യാൻ റൈറ്റ് ദാറ്റ് ഫുൾ വേർഡ്സ് ഹിയർ, ഐ മീൻ ദാറ്റ് പെർട്ടിക്കുലർ ടേം ഹിയർ. It is interleukin, then one receptor antagonist. Okay, so this is the correct answer, and this answer is mentioned in text D because I know that everything related to the treatment mentioned in text D, right? Okay, so here answer is mentioned as interleukin 1 receptor antagonist. So we can count it like 1, 2, 3. Okay, so that is the correct answer. Yes, Swati, very good, dear. Okay, Gigi, not swelling, dear, it's in the morning. Okay, so Kavita, it's not morning, in the morning. Yes, morning after lab. Beulah, it's not morning after lab, dear. Means it's not lab, it's nap, N-A-P, nap, which means siesta. Already that it is there in the question, so you can write in the morning. Okay. Yeah. Yes, Nami, correct answer. So the very next one, 13th one, which type of JIA has the capacity to influence all stages of the childhood? So my keywords: type, capacity, as well as all stages. Okay, and answer is systemic arthritis, which is mentioned in text B. As you can see here, systemic arthritis എവിടെ മെൻഷൻ ചെയ്തിരിക്കുന്നത് ടെക്സ്റ്റ് ബിയിൽ? യെസ്, ഇൻ ടെക്സ്റ്റ് ബി. See, systemic arthritis, 4 to 17% of that is the prevalence mentioned, the proportion mentioned throughout childhood, it is equal. So answer is systemic arthritis from text B. And the last question, question number 14. What pharmaceutical intervention is regarded as the primary drug for managing severe disease flares? Severe disease flares are directly mentioned, so you can search for the words severe disease flares. Again, the management is mentioned in text D. And where is it mentioned severe disease flares? I think here, see serious disease flare or severe disease flare. So answer എന്തായിരിക്കും വരിക? Answer is consider oral steroid. Don't write steroids, steroid. Oral steroid. O should be capital, S should be capital. Otherwise, your answer is wrong. Cut off. So, oral steroid is the correct answer. Name of the medicine. Okay, medication. Oral steroid from text D. So, that's that. Then 15 to 20, 15th one. For certain cases of JIA, the condition endures, which means tolerate or suffer, for a long time, demanding continuous treatment into dash. So, my keywords condition, endures, lifetime, or you can underline demanding, treatment. And you guys definitely know treatment is mentioned in what? Where? Treatment into. Okay, so maybe it's not in text D. I don't think so. It is in text D. I think it's in text A. Because the condition endures for a lifetime. So maybe in text A. And I think that particular thing or this missing word is yes. See the last line, few months or years, but in some cases it's a lifelong disease that requires treatment into adulthood. So answer is into adulthood or adulthood. Into is mentioned there, right? Yeah, already into is there. So answer is adulthood from text A. Okay. Yes. Yes, everybody is commenting. Thank you guys. Yes. Thank you so much for the active participation. Yes. So, adulthood is the answer. 16th one. Although the precise etiology of JIA remains elusive, its onset is attributed to an hyperactivation leading to initiation of the inflammatory process. Okay. So, elusive, which means mystery, not clear. Elusive എന്ന് പറഞ്ഞാൽ not clear ആണ് അല്ലെങ്കിൽ mystery എന്നുള്ള meaning ആണ് elusive. Okay, so what is the correct answer? Answer is immune system. Okay, immune system is the answer. Again, it is mentioned, I think, in text A. I've seen that word there. Etiology regarding this particular disease condition, just mentioned in text A. Idiopathic originates that are not understood, while the exact cause of JIA are unknown. It begins when the immune system becomes overactive, hyperactive. Inflammation. So answer is immune system. And you don't have to write that, I as well as S in capital. It should be in small. Okay. I've written here it is I capital. Actually, it is small. Immune system. Yes. 17. Gender distribution is in systemic arthritis is characterized dash potentially manifesting uniformly across the entirety of childhood. So what is the missing word here? Gender distribution, which is mentioned in text B, right? And regarding systemic arthritis, how is the gender distribution? As equal. See, very direct answer. Okay, systemic arthritis and the gender distribution is equal. See, here it is gender distribution mentioned. So answer is equal. Equal is the correct answer. Okay, so equal. 18th one. Imaging examinations might be prescribed to discern indications of dash. അപ്പോൾ ഇൻഡിക്കേഷൻസ് കൊടുത്തേക്കുന്നതും അല്ലെങ്കിൽ indications of which means symptoms mentioned in text A, but it's not about the symptoms. Discern, which means identification of symptoms. Diagnosis എവിടെയാണ്, which is in text C, right? അതെ. And what is the missing word there in text C? Imaging test പറയുന്നുണ്ട്. The doctor may order imaging tests such as X-rays, ultrasound or MRI or CT. Look for the signs of joint damage. Look for എന്ന് പറഞ്ഞാൽ എന്താ? Discern, identify. Okay, so എന്തിനു വേണ്ടി ഡിസൈൻ ചെയ്യുന്നത്? That is to identify signs of indicators of joint damage. So answer is joint damage. Okay, yes. Yeah, joint damage. 19. The reduced concentration of dash in the bloodstream may signify the existence of specific forms of arthritis. So reduced concentration of forms of arthritis. Yes. What about 19th one, guys? And 19th one is mentioned in text C, I think, because the keywords mentioned in text C. And as you can see here in text C, complete blood count CBC raised the levels of white blood cells and decreased the levels of keywords, right? Red blood cells. So answer is red blood cells. That is the missing words there. So red blood cells from ecstasy. And the last question, question number 20. If the initial medication proves ineffective, alternative drugs such as leflunomide or dash may be explored as potential substitutes. So what you can substitute there? And I think that word is starting with the D because I remember some, medicines there. And answer is mentioned here. See, leflunomide is mentioned here. So what is the alternative mentioned? It is sulfasalazine. Okay, so that is the word, sulfasalazine. I hope the spelling is correct. So that is SUL, sulfasalazine. Okay, so that is the meaning. I mean, the spelling. Okay, so which is in text today. So that's all about that. Yes. So anyone with 20 out of 20, let me know in the comment box. If you have scored 20 out of 20, I'll be very happy. And also, if you guys are just seeing this live session now, please do the material and do comment your answers in the comment box. I'll reply. Okay. So thank you so much for today. Yeah, take care. Thank you.